Performance skill number 11. Transfer using a mechanical lift. Standard, transferred person safely utilizing a mechanical lift. May be tested in the classroom or in the clinical setting. Followed facility policy for use of lift according to manufacturer's instructions. Identified appropriate lift for resident. Applied correct sling belt. Attached sling belt to mechanical lift.
Now we're going to slowly lift you.
Verified resident's readiness for transfer. Operated the mechanical lift controls according to manufacturer's instructions. Maneuvered the lift safely. Lowered residents safely.
Now I'm going to slowly let you down.
Disconnected sling belt from lift. Remove sling belt if applicable. Performance skill number 12. Ambulate with transfer belt. Standard, ambulated person safely utilizing transfer belt. May be tested in the classroom or in the clinical setting. Locked bed or chair wheels if appropriate. Ensured the person was appropriately attired, including non-skid footwear. Apply transfer belt firmly around person's waist. Should be adjusted to allow evaluator to place 2 fingers between the belt and the person.
So what I'm going to have you do is I'm going to have you scoot just a little bit forward, okay? And then on the count of 3, we're going to stand up, and I want you to push off the bed with the palm of your hands, and then we'll stand straight up, okay? Okay. 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 On the count of 3, 1, 2, 3, all the way up.
Assisted the person to standing position.
Okay. Stand up straight, lift the head. Okay. What I'm going to do is I'm going to go.
Stood at the person's affected side, if applicable, while balance is gained.
Head. And we're going to go ahead and start walking, okay? Take a few steps forward.
Ensured the person stood erect with head up and back straight as tolerated.
Your head up, look straight ahead. Good.
Assisted the person to walk. Walk to the side and slightly behind the person. Held transfer belt using underhand grasp. Encourage the person to ambulate normally with the heel striking the floor first. Discourage shuffling or sliding if noted. Ambulated the required distance if tolerated. Assisted the person to return to bed or chair. Remove transfer belt appropriately. Performance skill number 13. Feed a resident. Standard: resident is fed prescribed diet in a courteous and safe manner. This care must be provided to a resident. The student should be assigned to feed someone without any special feeding techniques required. Prepare the resident for the meal, i.e., allowed resident to use toilet and wash hands. Position resident in sitting position as appropriate. Matched food tray, diet items with resident's diet order. Matched food tray, dietary items with appropriate resident. Protected resident's clothing as appropriate, or as resident prefers. Noted temperature of food and liquids to avoid food that is too hot or too cold. Fed moderate-sized bites with appropriate utensil. Interacted with resident as appropriate, i.e., conversation, coaxing, cueing, being positioned at eye level with the resident. Alternated liquids with solids, asking resident preference. Ensure the resident has swallowed food before proceeding. Clean resident as appropriate when completed. Remove tray and cleaned area. Performance skill number 14. Calculate intake and output. Standard: total intake and output quantity is calculated without error. May be tested in the classroom or the clinical setting. The student is to measure intake and output in cubic centimeters or milliliters. The student may be told the fluid capacity of the containers, glasses, cups, bowls. Wrote down the intake and output amounts in the units used to measure the intake and output quantities, such as cubic centimeters, milliliters, ounces. Converted the measured unit into the units to be recorded on the resident intake and output chart. Calculated all the measured quantities listed as resident intake to obtain a total amount of intake for the time period. Added all the measured quantities listed as resident output to obtain a total amount of output for the time period. Recorded the total intake and output to be compared to the recorded intake and output calculation of the evaluator. Performance skill number 15. Place resident in side-lying position. Standard: body aligned with dependent extremities supported and bony prominences protected. This care must be provided to a resident. Either of two positions is acceptable: side-lying position or variation in which knees are flexed with appropriate padding between the knees and ankles. Raise the side rail on unprotected side of bed if applicable. Position resident on side in the center of the bed in side-lying position. Placed appropriate padding behind back, under head, between legs, supporting dependent arm. Ensured resident is in good body alignment. Raised side rails if appropriate. Performance skill number 16, passive range of motion. Standard, completed 3 different range of motion exercises without going past the point of resistance or pain. This care must be provided to a resident. The body part to be exercised must be supported. The student is not to force a joint beyond its present range of motion or to the point of pain. The student is required to name the exercise being performed, such as abduction, flexion. The approved evaluator will verify the number of repetitions for the selected range of motion exercise with the student.
Here to help you do your passive range of motion.
Demonstrated 3 different range of motion movements.
Is it okay?
Okay.
We'll start with your shoulder. Bring it up to your shoulder for
Flexion and extension.
Okay, we'll do a couple more. Abduction.
Abduction and adduction.
Adduction. All the way down. Are you having any discomfort?
Pronation and supination.
Okay. Bring your toes up.
Dorsal and
That's
plantar
dorsal
flexion.
Straight out. Plantar flexion. Up and down. Any discomfort?
Opposition. Support of the proximal and distal ends of the extremity or the joint itself. Observe the resident's reaction during the procedure.
Adduction. Tell me if it hurts at all.
Demonstrated or verbalized the need to stop moving if pain or resistance was noted.